Okay, I think we're good to start. Hello and good evening. My name is Erin Ruggieri. I'm one of the marketing coordinators with the School of Health Sciences at BCIT. And thank you for joining us this evening for our Digital Health Program information session. So the majority of our presentation tonight will be done by Glenda, our program head for digital health. Thank you for the little wave, Glenda. And we do ask that you stay on mute through the presentation until the end portion when we have some questions and answer time, and then you can unmute and ask your questions then. But staying on mute just minimizes the interference for everybody while we're going through. So with that, I would like to start by saying that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional lands of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam people. And getting right into it, our agenda is our welcome introductions that I'm doing right now. I actually don't think we have a poll question for this session. That's normally in some of other sessions. Presentation and program overview, some information about our program advising department and how to contact them and how to get all the admissions info. And then at the end, like I said, we're going to have some time for questions and answers. So if you do have any questions as we go along, you're free to type them into the chat function that you might see at the top or bottom of your screen right now, or you can just hold till the end and we'll answer some questions then. And with that, I'm going to pass it over to Glenda.
Hi, everybody. Thank you for joining us today. I'm Glenda Reese. I am the program head for the Digital Health Advanced Certificate. And as you may or may not know, this is a fairly new certificate that we're offering. Our very first group of students started in the spring of this year and are now halfway through the term, and it's all been going well and moving along nicely. And I think the students are finding it quite beneficial. And our next intake is for the fall of this term, and then again in January of 2024. And today we're just going to talk a little bit about the program. You'll see some of this information on the website as well. And as Erin said, if there's anything, ask questions at the end, and also feel free to contact us individually as well if you need to. I think we can go to the next slide. No. So what is digital health? So digital health, as defined by Canada Health Infoway, is the use of information technology, electronic communication tools, services, and processes to deliver healthcare services. And that's one definition. There are several definitions out there, and we actually explore the different definitions in the very first course that we do in the Digital Health Foundations course. And we get into sort of what it means. And for us in the digital health program, it is very closely tied to our patients, families, communities, and populations. And our intent always with the digitization of data and the actual kind of healthcare context is to improve patient outcomes, to make the decrease the clinician workload, and reach other indicators of the quintuple aim related to equity, efficiency, cost, and as I said, basically the care experience. So next slide, please, Erin. Why would you choose this program? So this area, this intersection of technology and healthcare, as you may expect or may experience yourself, is definitely a space where there is a lot going on. It is kind of moving society forward, and in healthcare, the possibility for transforming healthcare and the actual the patient experience and the clinician experience and all things related to the healthcare environment is there's so much potential there. It's an emerging and rapidly evolving field, and we need people in the space. So we have, fields within the kind of clinical sphere. So, nurses, doctors, physiotherapists, occupational therapists, cardiac technicians, pharmacy, many healthcare professionals. And then we have many people who work in the IT space or the computer science area or data analytics. And so bringing all these fields together to work towards improving the patient experience is really what this is about. And with the current healthcare crisis, this is an opportunity for technology to kind of help with that and improve things in the healthcare system. And we need people to do that. Next slide, please, Aaron. So in knowing all this, we've developed a flexible program, which is, it can be taken part-time. You can take anywhere from 1 to 3 courses per term. And if you take all 3 courses per term, and I'll get into the actual program map in a minute, the whole program can be completed in 1 year. Otherwise, you can take it one or 2 courses per term up to 5 years. So you can spread it out over up to 5 years or take it within 1 year. So we have 7 online courses, and then we also have a capstone project. And the capstone project is completed in the final term. And then the other 7 courses all lead towards that capstone project. So in the next slide, I can just speak to that a little bit more. Oh, sorry, it'll be the slide after this, then we'll get into that. So if you know, as you hear a little bit about this, is this something that would make sense for you? We're admitting healthcare professionals into the program who either have a bachelor's or diploma in healthcare, but we also know that you know, that people who don't have healthcare education, but who have worked in the healthcare system for a long time would also be eligible for this program. And the reason that we're kind of looking at that healthcare experience is because it takes time to teach the healthcare system, and for you know, it's important to be able to understand what the healthcare journey looks like for the patient, who's involved in the healthcare team, what certain areas of the healthcare environment exist. And so knowing that in whatever field you're coming from will help support you through this program. But if you're in the healthcare field, or intrigued by technologies, wanting to know how they may impact healthcare, feeling distressed about the healthcare crisis, and seeing the optimization of healthcare as a strategy, then this may be of interest to you. And as I said, having that background and an interest in technology and wanting to make a difference is are characteristics that we're looking for. Next slide, please. So along the way, you will gain new knowledge and skills, and these are just some of the pieces of the program, but essentially all related to data standards, technology and information solutions across systems, across health information systems and health, we call them digital health ecosystems. The use and measurement of clinical data and outcomes, and change leadership and project management are all threaded throughout the courses, all the way through the program. Next slide, please, Aaron. So this is the program map, and if you took this program full-time, this is what your kind of course load would look like. So it's 3 terms over 1 year, 24 credits. Each course is worth 3 credits. The Digital Health Foundations, or the 7,000 course, is our prerequisite or co-requisite to the other courses. So this course is one that you would need to take before you took the other courses. It is also a standalone course if you wanted to just sort of get a sense of what digital health is about. If you haven't been in school for a long time, you're not sure what this workload would look like, then this would be a good course for you to think about taking. And together with that is the digital health ecosystems, which looks at interoperability across health information systems. And then our data fundamentals course, which is a prerequisite to data analytics in the second term. And both those courses are tied together so that you're building your data knowledge and your literacy around statistics and the kind of interpretation of data to bring it together to tell the story of the data, so that you can then support the presentation and visualization of that to other stakeholders, whether they be patients, other healthcare team members, leadership within your organization, etc. And then the second term, together with the data analytics course, has 2 courses: optimizing care delivery and outcomes and enabling quality-driven care. And all those courses really take the theory and the knowledge that you've learned in the first term and apply it very much to the healthcare environment and to the context of digital health, and focus on kind of systems thinking, design thinking. We use a virtual care case study that spans 5 weeks that you analyze and work through. And then you move into the next term, which is project leadership in healthcare, which is an existing course in our healthcare management department, and then the capstone project. And all along the way in these courses, our assignments are meant to be related to then the kind of your work towards the capstone project. So early on in the program, we sit down with each of you, each student individually, and have a conversation about where you would like to see yourself towards the end of the program. And then we try and line up that capstone project with an industry partner, whether it's in the private or public sector. And then we work with you to link you up with mentors as you move through the program and as you work on your assignments that get you towards the capstone project. And so the idea with all of this being is that they're kind of building blocks towards the final course. And we also, if you're taking all 3 courses, if you're doing this full time and you're taking 3 courses per term, we try to line those up thoughtfully in a way so that your assignments are staggered and your kind of workload is somewhat manageable. So we do have students currently who are taking these full time and also working full time, and it's a fair amount of work, but it is manageable. Next slide. And so this is just a little bit about our educational approach. So we've tried to be really thoughtful about how we deliver this program. And so it is interdisciplinary. So we have lots of different healthcare team professionals and all people with healthcare backgrounds who are working together, and you're sharing and having discussions online about various case studies. It's case-based. So we use case studies to kind of bring real life to theory so that it's relevant to what's happening in the world. And that also allows us to keep the content current, because as you can imagine, this is an ever evolving area, and from week to week, something different is going on in this space. So by having the case studies, that allows us to make it a little bit more agile in terms of the content that we cover and the discussions we have. And we try to keep it, as flexible as possible. Everything is online. It's a fully online course, fully online program. Each course has mostly asynchronous sessions, so you're learning as you go through week by week by week. It isn't completely self-paced. You do each module builds on the previous one, but not all the sessions are. Very few in each course, probably 2 or 3 in each course are synchronous sessions. We try to line those up. Most of those are in the evening so that anybody who's sort of working a day job would be able to attend them. And for those who cannot attend, we do record everything so that you can, read it, listen to it later afterwards. So we try to kind of, we recognize that people are either, working, have full lives, and that classroom times don't always work out exactly according to everybody's schedules. We do have project management integrated throughout the courses, so that you're building your project management skills, and these do work towards your project management certification as well. Change leadership, there's so much in this space that is around change management and understanding the change process and being able to kind of lead people through that. So we spend a bit of time on leadership theories and philosophies, and determining your own leadership philosophy as you take the courses. And then it's obviously team-based. We do a lot of student work where we're bringing students together, and we have an equity-oriented focus. So we're always coming back to that. And it's quite learner directed. So students are really directing the conversation and the pace and some of the content as well. I think that's it in there. So is there another slide? I think this is you, Erin.
Yes, I can
Yeah,
take on
let's do it.
I can take on this one.
Yeah.
Thank you, Glenda, for all that information. And again, if you have any questions as we go along, you're welcome to put them in the chat, or at the end, we can have some time where people can unmute and ask their questions if you feel comfortable with that. So I'm just going to talk about kind of what the process is if you want to start the program. So as with any BCIT program, we do have some academic entrance requirements. And this first one is fairly standard for most BCIT programs. We do require that you have done 2 years of your education in English in an English-speaking country. And you must have English Studies 12 or 3 credits of post-secondary English Humanities or Social Sciences from a recognized institution. So English 12 used to be called English 12, now it's called English Studies 12 or English Indigenous Peoples 12, or there's a few different names for it now, but you're English 12. Secondly, as Glenda mentioned, you want to have post-secondary education, either a diploma, degree in an accredited program in a healthcare discipline. But there is an option if you have a diploma, an associate degree, a bachelor's degree from another discipline, and then you have experience working in the healthcare environment. We'll talk more about how you show that. So before you go to sign up for a course or apply for a course, what you do is there's a pre-entry assessment form on our website under BCIT Digital Health entrance requirements, and that form is there as a PDF, and you can just click into that and write into that. This form is basically designed for us to be able to assess your education experience and your interest. And you would submit that form to Glenda directly at her email address, Glenda_Reese, and that's on our website as well. So once she says, check, yes, that's good, she'll sign that form, and you'll get a copy of that signed form, and you will submit that with your online application to BCIT to prove that you have the previous requirements that we mentioned. And then once that's all good, you're good to start at one of our start dates. So those applications can be submitted all year round. There isn't a specific application period. Submit those applications all year round. When we accept you, when you've applied and done everything, you can start the course at the next intake, provided there's space. So we run 3 terms a year at BCIT. First in the winter is January to April. The spring is April to July, and fall is September through December. So again, you would start at whatever kind of the next intake time is. And as Glenda mentioned, maximum time to complete the program is 5 years, but it is doable in 1 year if you want to take a full course load and do 3 courses at once. So the application steps, as I mentioned, you review the requirements on our website, you review all the information there, you complete the form, you convert all your documents to PDF files, and you apply online on our website. We do not accept paper copies. We don't want to see a paper copy of your transcript. Everything now gets uploaded online, so you can either order it as a PDF from your previous institution, or if you have the document sitting in front of you, you can just scan it. Take a good photo of it so it looks like a scan with your phone. Either way, we just want it as an image or PDF file. We do not need it hard copies anymore. So that's changed a bit in recent years. So again, academic entrance requirements, English 12 with at least a 73% or 3 credits of post-secondary English, Humanities, or Social Sciences. So we really just want to prove that you have those communication skills. We all know healthcare has such a huge communication component, and if we can't discuss and communicate with each other and our patients, then it's going to make things a bit more difficult for us. So we really do require those English requirements. Again, I think I kind of went over all of this, but once you are admitted to the program, there is a commitment fee that all students have to pay. I don't remember exactly how much that is. There's also an application fee. I believe the application fee is about $85 or $90, and that is paid all to BCIT just to confirm your spot. Once you are a student here, once you've committed to this program, or you've committed to doing 1 course even if you're only doing 1 course, you're considered a BCIT student. Even if you're not on campus, you're considered a BCIT student. So you will have access to the many supports that we like to offer at BCIT, including our Indigenous Services Department. They offer a welcoming gathering place, and They often have different events for students who identify as Indigenous or students who are curious and would like to learn more about Indigenous services. We do have financial aid available and bursaries and awards that you can apply for. We have accessibility services. That's for students who are experiencing either a long-term or a short-term disability and might need some kind of accommodation in their studies, either extra time to complete an assignment or a test, or need some kind of accommodation there, and you can connect with accessibility services. We have student health services, which I really like. It's a full service medical clinic right on campus. So if you can't get into your GP or you no longer have a GP, like many of us in the province, you as a BCIT student are welcome to come and visit student health services. They do require pre-booking of appointments, but they can often get you in same day, which is amazing compared to what my GP's office is like. And just down the hall in the same building for them, we have counseling and student development. So again, counselors, psychologists on staff, free for any BCIT student. And we have recreation services. So we have our full service gym. We have intramural sports available, a great weight room, lots of cardio machines. So it's definitely something you can check out once you're a student here. Program advising. So if you have any questions about this program afterwards and Glenda and I aren't able to answer them, or you think of something later on and you don't want to email Glenda, you can definitely also contact our program advising department. They are available to assist by phone, by Zoom. They have in-person times, they have email. Didn't put their times right here because their times keep changing, especially now that we're rolling into summer. So if you go to bcit.ca/advising, all their current contact information is up there. And they're kind of the people on campus that just know about all of our programs and know how to get your application in, how to do all the things. There's so much stuff to know when you're going back to post-secondary and you haven't been for a while, and they're here to help you out with all of those details. And I have to put in a shameless plug for all of our social media channels. I run most of these, so this is why I really care about this. We are on Facebook, Twitter, Instagram, YouTube, LinkedIn. We would love it if people could give us a follow. It really is a great way to learn more about what's going on at BCIT, see things from a student perspective, kind of see what's going on in health sciences. We post a lot about what our students are doing in labs and news in health sciences. So we really would love a follow from you. Other than that, we're moving on to questions and answers. That was a lot of information, wasn't it? Oh, Glenda already answered one. That's why I see like 2 in the chat here. Oh, Chad, that's great. So there's a group of you all watching together. That's wonderful. Recording and the slide deck will be emailed out. It will take us about a week to get ourselves organized because we have like 12 info sessions we're running this week. So we'll take about a week to email this all out to you, but it'll also at the same time be posted on the website. I know the previous info session we did is posted on the website right now, but this one's better. So watch this one when it gets posted there. Now, did anybody else have questions about this program for Glenda? You're welcome to unmute yourself if you do, or raise a hand or put something. Oh, there's more things in the chat.
Sorry, that was just you. That was me and Ruby, just a LinkedIn specific to the site as well. So that was health sciences, but we also have one for the digital health program.
But Ruby has a great question in here too. She says, thank you for all the info. I'm curious about the admissions. Is it competitive to get in, or is it just a matter of meeting the requirements? I should have answered that. Yes, that's a great question. And is there a limited number of spots?
So we have 24 spots for the full term, and they are filling up right now. So it's really a kind of first come, first serve at this point. So if you meet the requirements and you're, ahead of number 24, then you'll get in, or ahead of number 25. So I would just encourage you to get on there and if you're interested to register. And then if you don't get into the full one, then we'll, have seats available again in the January cohort as well. For the fundamentals course, if we can go over 24 because it's a little easier to manage that course, but for now we're kind of saying 24, and yes, you can. Oh, where did that go?
Yeah, that was there and it disappeared.
Somebody was asking about, can you register now? And yes, you can register now.
Yes. So, I mean, if you know you don't want to start in September and you won't be ready, you can just tell us you're interested in starting the January when you submit your assessment there. No worries about that. We understand that people have to plan out their lives, and that's totally part of it. Can you sign up for the fundamentals without being in the full program yet?
Yes. So you can sign up. All of these are under our flexible learning program. So you can sign up as just a once-off course. The foundations course is a prerequisite or co-requisite. So that one is the only one. It's not the only one, but you have to do that one first, and then you can register for the other ones. But if you want to get the certificate at the end, then you need to register for the program. But for now, as long as you are feeling that you just want to do one, you can absolutely do that.
Yeah, we have a lot of that in our flexible learning part-time studies areas. It is sometimes nice to just take a sample course first, take that first one before you're sure you want to commit to doing all of them. And that's fair. Yeah.
Yeah. For Winnie's question, we have our very first cohort just started in the spring of this year. So we don't have any alumni yet. They are only 6 weeks in, so it's a brand new course. What we do is we direct kind of applicants or people who are interested in the program to the Digital Health Canada's career matrix that outlines different careers in the space. And there's a emerging level and a competent level, and both of those would be applicable. So there's several jobs in that space. We work really closely with industry. So all along the way with this program, we've had advisors from the health authorities all around the Lower Mainland and Northern and actually Interior Health as well, to help us make sure that the program is very relevant to what's happening in kind of healthcare right now, and that it's applicable. And so, all of those kind of that advisory group, and most of these have been from either the CST project or Meditech, with Fraser Health and Vancouver Coastal Providence and PHSA are all working together for some of you who may or may not, with the CERNA and the Clinical Systems Transformation Project, or CST project. And so we've worked with leadership in that space, and we continue to have conversations with them. And so with all of these assignments leading towards a capstone, we would be linking you up with those kind of teams and areas that you might be interested in, to make in a job that you might be interested in, so that when you graduate from the program, you have opportunities to move into areas that you're interested in, if you're not already working in those areas. So no short answer right now, Winnie, but we will have alumni by spring of next year of 2024.
Kelly is asking, how many hours per course?
It's a great question, Kelly, and that's a very popular question usually. So the way it works is that each 3-credit course, if you were taking each of these courses in a classroom setting, it would be you'd show up and you do your 3-hour class, and you would probably be expected to do about an hour or so of pre-reading and maybe a little bit of post-classroom work. So, kind of taking that information and applying it to the online setting isn't exactly accurate, but it's more or less how we kind of anticipate the workload to be. So you're kind of doing readings, you're responding to questions that we as your instructors are posting on the related to the online discussion and readings that you've done. And then you're working in teams, and then each person in the team responds to at least one other person in the team. And then the instructor will do kind of a wrap up for you each week, and then you move on to the next week. And so the workload is really around the readings and accessing resources to answer the questions that are relevant to the context of the readings, and then there might be some activities and kind of around the discussion posting. So it's not super We try not to, we've got one, well, actually we have 2 textbooks for the whole program. So it's not, we're not expecting you to buy a whole lot of textbooks. We have an informatics textbook, and then we have a business analytics data textbook that has healthcare. It's related to healthcare as well. And so the readings that we do are mostly just kind of articles or directing you to resources. So it's not super onerous. Our projects and assignments are, there's a couple of sort of small papers, like 5-page papers. We're not expecting long academic papers. We do quite a few quite a few team or group work assignments and kind of reflective papers. And then we do some like you'll do like a little presentation around a topic with your team online, and we kind of keep it as relevant as possible so that we're not spending hours and hours on theory. So hopefully that answers. So like 4 to 5 hours per course per week. Carol, most people coming into this will either have kind of a clinical background and maybe an interest in technology, or have a kind of IT computer background, but are interested in healthcare. So there's different groups of students with different backgrounds coming to the program, which makes it interesting, and there's a lot of cross learning that happens. But we're not spending a ton of time doing. We're not coding. We'll talk a little bit about kind of what coding is and what it means, but you're not going to learn to code, and you're really just learning to understand and be able to have conversations with coders and IT people and computer people and statisticians and data analysts in the context of whatever's happening in the healthcare environment. So the short answer is no, it shouldn't be difficult without an IT background. Hopefully, at least you have an interest in the IT side, though. Yeah, so the examples of jobs, what I'll do is I'll post that matrix, the link to the matrix as in a second, and as I just have a minute here. And then so within public health, so public health is a huge space and a huge area for, we have like public health informatics as a whole field in public health informatics, and we do we have a couple of modules related to planetary health informatics and global health informatics and public health informatics. And so, within that area, it's kind of not a short answer. There's lots of roles in there. And if you're in public health, I would just Google public health informatics and just see what's out there to give yourself a sense of some of the kind of roles that are there. And as I say, I'll post this in the link as well.
Glenda, do you want to talk a bit too about what kind of people are coming into the program? So is it just, we've got maybe nurses, doctors, who else would come into this program?
So we have some technicians. Sorry, let me just post this link here.
Sorry.
So this is the link to the matrix. So if you look at this matrix PDF, there's emerging professional level and a competent level. And as you scroll down, you'll under each of the levels, you have to go kind of right down to the bottom of the page. You'll see the different roles that are in there. So that gives you an idea of kind of some of the roles that this would be applicable for. Probably doesn't cover all of them, and there's some there that you might be more interested or have a background that would be better suited to a different role within the matrix. So the type of students we have, nurses, we have some doctors, we have cardiac, pharmacy, we have a couple of people in dental hygienists who in that field there's a whole field of dental health informatics as well. We have a couple of like project manager and somebody who's been working like on a health IT help desk, but who has a nursing degree from a different country. So they're kind of bringing that over. We have a unit coordinator, so someone who's been working as a unit coordinator for a long time in the healthcare system, loves this kind of technology side, and so is using this program to help them move kind of through some different areas. The there was another group that I was just thinking of, sorry. We have some people from who are in public health, kind of interested in public health, population health, lab, a couple of people coming from laboratory system, like working with lab information systems as well.
But a lot
I
of
would say if you're not sure, like I am absolutely open to, if you don't have to send me the form, you can just send me an email saying, hey, this is my background, this is what I'm interested in. Does it make sense for me to even fill in the form? And I might say, let's jump on a quick call and have a conversation, or send me the form and then we can have the conversation. Or, don't if you're here today and you've showed up and you're feeling interested in this, I hope you're not going to walk away and go, oh, this, I don't have the qualifications, maybe you don't, but if you're not really entirely sure, then please reach out and we're happy to see how it works. I'll also just say with the English prerequisites, with BCIT's English prerequisites, there are alternatives as well for getting that the sort of certification around English as well. So, and sometimes there are ways to, if you've been working here but you haven't done the certification, we'll work with the registration office to see what we can do to support you through that process as well.
Yeah, we do have the International Credential Evaluation Service as well.
Yes. Thank you.
If you have any international credentials and done your schooling outside of Canada, we can definitely talk to you about the process of getting those evaluated. Yeah. Okay, it doesn't look like any more questions. So I just want everyone to note, again, Glenda's email address, Program Advising's email address, and our website for digital health. Please do send us any questions. We are always welcome to chat with people, and we're really glad that you came and joined us tonight.
Bye, everybody.
Bye, everyone.